Discussion keeps the world turning.
This is Roundtable.
A new policy in China is letting us share the money in our health insurance wallet with our children, parents, grandparents, and even siblings nationwide. One app, one tap, one family safety net. And how can this digital wallet bridge the distance between us and our aging parents 3 provinces away? And then that sunscreen review you just saved might be a paid ad. The unbiased car test you just watched likely on the brand's payroll. And China's new rules are trying to clean house, but can regulation actually rebuild trust between customers, brands, and the influencers we used to believe? Coming to you live from our studios in Beijing, this is Roundtable. I'm Fei Fei, and for today's program, I'm joined by Steve Hatherley and Yushun in the studio. And first on today's show, China's introduced a major upgrade to its medical insurance system. Workers can now allow family members living in other provinces and regions to use money from their personal medical insurance accounts. And the reform expands the family sharing function of China's healthcare system and expected to be fully implemented nationwide by the end of this year. So today we'll expand on the details of this new reform and more importantly, why does it matter? But before we get into the details, Steve and Yushun, I think we also still need to start with the basics, like how does China's medical insurance system work?
Yeah, so imagine a country with 1.4 billion people. How do you make sure everyone can afford to see a doctor? And China's answer is a 2-tier health insurance system. If you have a job, your company and you pay into the employee insurance. If you're a child, a student, a farmer, or retired, you join the resident insurance with most of the cost covered by the government. And that's why more than 95% of Chinese people are covered by the social health insurance. And how does it work? So, for example, for hospital stays, you first pay a small deductible, say like $100 to $300 for that visit. Then the insurance pays 50% to 85%, depending on which hospital you choose or what kind of illness you're having. So there's also an annual cap, but for really big bills, a second layer called major illness insurance also kicks in, which means that you can reimburse a larger amount of money from this bill. And what is not covered by the health insurance nationwide, one is the very expensive imported drugs or VIP rooms in the hospital or cosmetic treatments. So for everyday clinic visits, the employee plan gives you a personal account, and you can think of this account as a healthcare wallet, as Fei Fei just mentioned. The money belongs to the insured person and can be used for approved medical expenses, such as outpatient visits, prescription drugs, and certain healthcare services. And the resident plan offers less outpatient cover.
Yeah, and the resident medical insurance actually cover those who are not employed in some sense, like children, students, retiree or unemployed, or even rural residents. I think some of my relatives living in rural China, they paid I think 200, 100 yuan a year into their own health care insurance, and then they can be covered by the larger pools coming from the medical care system.
It is also a kind of a national fund. So that's why these kind of people, they pay a certain amount of money into the pool, and then when they need to see a doctor, they can reimburse from the whole pool.
Yeah, so that's one of the unique features, I guess, about China's employee insurance system is that when an employee contributes, right, at the end of each month, you get your paycheck, and then you have things that are subtracted from your paycheck, like your taxes and stuff like that. One of the things is health insurance. Part of the money goes into, when the employee contributes to that at the end of each month, part of the money goes into a collective insurance fund, and that will pay for major medical expenses and hospital reimbursements, things like that. Another portion of that will go into the employee's personal medical account. That account is like a wallet, like you said, and the money belongs to that person. It belongs to you, and it stays in that wallet, and you can use it for what they call approved medical expenses. If you go to the hospital, you need to do something medically related there. If you order some prescription medication, you can use it for that, and certain other healthcare services as well. And we'll get to this a little bit later. The money that goes into that account previously, as far as I understand, if you didn't use it, then it would just stay there.
Yeah.
And it would accumulate and accumulate and accumulate, which is a really good thing. And I think a little later, too, maybe we'll draw some comparisons between the housing fund and the medical fund, in the sense that now we're seeing both. We talked about the housing fund on a previous episode of Roundtable. Go listen to that if you haven't already. But we saw there that it's opening up. You can use that money a little bit more freely, and we're going to see that here in the medical funds, too.
Yeah, and in some sense, I think the recent reform we're talking about today are sort of following very similar directions to the housing fund, is trying to encourage people to use this money more flexibly, because when it comes to the personal medical account that Steve just talked about, I think we have a set of data that as of 2024, we have over 1.4 trillion yuan. That is close to 200 billion US dollars sitting sort of dormant in a lot of people's personal accounts. They cannot be used otherwise. They cannot be withdrawn. And if the insured person is not in the demands of medical services, that means this money is just sitting there and used and stay idle for a long time. So that's why we're seeing this new reform and trying to expand the usage of individuals' personal accounts. And when it comes to this new reform, and it's called province sharing medical insurance system, Yushun, what is the general idea about having that money shared?
The simplest way to understand it is that money in a worker's medical insurance account can now be authorized for eligible family members living in another province. So there are 2 points I would like to mention. One thing, we talked about it before, actually. It was about your insurance account can be connected with your family member, and then they can use the money in your account. But back then, your family member or these two party has to be in the same region. But now it is getting into a nationwide policy.
Question. You said region. Does region mean province? Does region mean city?
Well, it depends on the places, right? Some are within the same city, some are within the same province or region, depending on local policies. But there are also like limitation of what kind of family members that you can include into this sharing work.
That was the way it was, but with this reform, now those borders, those regional borders, are being eliminated, metaphorically speaking.
Exactly. So the contributor must be a participant in the employee medical insurance with funds in their individual account. And then who are the one that can be connected with your account? They must be a close family member of the contributor and also be insured by either the employee or resident basic medical insurance. So both these two parties need to have at least one type of medical insurance, and they can be the close family member, which following the civil code includes 8 categories: spouse, parents, children, siblings, grandparents, and grandchildren.
So this is kind of like, the equivalent, I suppose, would be like the way bank accounts work, in the sense that if I have a bank account in Beijing, but my grandmother needs to use or have access to that account, but she lives in Chengdu. Well, she can't get that money unless she has her own account. I know WeChat and blah, 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 but just follow my example. So therefore, it's the same in the sense that in the health insurance case, because she needs to be registered
That's true.
for health insurance in order to benefit or have access to my health insurance money from here in Beijing.
Or
That's true.
for another scenario that is now quite common in China now, that is one person who is probably working in another major city apart from their hometown, but his or her parents still live in their hometown. But in his city, he can kind of have a better paycheck, which means that they can have more money in their like medical insurance account. But the thing is that luckily the person does not need to go to the hospital that frequently, which means that they accumulated quite an amount of money in their account, and then they can use the money for their parents in another city.
Yeah, and that also helps, I think, in other scenarios. For example, in my family, my kid can use the money in my husband's medical insurance account and to pay her. She was covered, of course, by the medical health insurance, but the extra payment, extra expenses when it comes to her hospital visits, her medicine that we need to go to pharmacies to buy, we can also make those purchases with our own money sitting idle in our own personal account. And another scenario, for example, my parent, for example, has chronic conditions and need to go to the pharmacy on a regular basis to get some medicine. And then I can buy their medicine using my money. And because, of course, I don't have similar conditions and I have more balanced, bigger number in my balance when it comes to the medical insurance. But there are some procedures that both the contributor and beneficiary need to go through to establish this sort of link in the system in some sense.
The process primarily operates through the digital platform called as medical insurance wallet. Basically, so the both party needs
that's an app, right?
That's an app. You need to download that app on your phone. And then both of your personal information will be on the app when you registered or you log on. And then you two can get connected. Download the National Healthcare Security Administration app. Find and also activate your medical insurance wallet, and then transfer funds or set a monthly sharing quota for designated family members, because the information are all under the national healthcare system.
And you can set the monthly amount within the app yourself.
Yeah.
The amount to be shared. All right. So then once you get the app, once you have it downloaded, you have to obviously go through an authorization process. But then the beneficiary, grandma or whomever, can present their own medical insurance credentials at the hospital or whatever medical institution, and then you can have your out-of-pocket expenses covered by the app, which is the wallet.
And also the employee, well, the contributor, I think, who owns the account can decide, for example, exactly how much money you want to make available for a family member to use.
That's the quota, right?
Yeah. And also for the unused portion of that quota, that doesn't mean it just needs to be locked away in the account. You can still take it back anytime without any other procedures required, basically meaning you take full control of the money in your own account. But there are also some important reminders I think we need to share with our audiences, isn't there, Yushun?
Yeah, it seems like, my money in my account can be freely used by my family members, close family members. But the thing is that you cannot use my identity to go to the hospital or buy some medicine.
Sure.
Because when an employee shares the funds in their personal account with a family member, that family member must still use their own medical insurance card and their own coverage rules, like reimbursement rate, deductible, coverage cap, and all other benefits can vary between employee and also resident medical insurance, and maybe also according to the local policies.
Yeah, you don't visit the hospital as a different person.
Yeah, but you can use the money. It's just you can't.
Yeah, exactly. Another important assurance here, and this might sound a little bit like an obvious thing, but if grandma goes to the hospital and gets treated and has a medical record there, grandma's medical history, it's not recorded under her grandson or granddaughter's name. So the contributor, it doesn't go on their account. And again, that might seem like a little bit of an obvious thing, but in some systems, maybe in some countries, or if you have an older insurance setup, if grandma used a shared health fund or a family policy, the claim at the hospital could be tied to the employee's policy number if the system was set up right now, and that way, and that could potentially be a problem in claims history in the future. But here, that's not an issue at all. So if you were curious about that, in this case, it means that if your grandma or your parent uses the shared healthcare fund for a particular treatment, the insurer will not see you as having that particular treatment done. It stays separate.
Yeah, and I think the core concept when it comes to this reform to our healthcare system is basically tapping into a lot of money that's not being used before, sitting idle in the bigger pool in the public funds, and so that the current system, the current reform can meet new challenges in our society. So when we're talking about new challenges, what do you think are the most prominent problems, for instance, this kind of policy is trying to answer at current stage?
One of the biggest is the digital divide, I think, 'cause that's the first thing that we talked about, how to use these funds, right? You need to download apps. But for maybe older people, it is quite hard for them to manage how to, download an app and connect your account with another person. Many of these new services rely on smartphone apps and digital platforms, while younger users can usually navigate them with ease. Some older people, especially in rural areas, may find the process a little bit more difficult.
Yeah, I mean, that's kind of that's an easy fix, though, maybe, in the sense that you could have local community classes. Maybe the hospital could set up, or clinics could set up a local class for elderly residents. Okay, here's how you use the app. Here's how you set up. If not, your family members. So to me, that seems like an easy fix. Another perhaps more pressing challenge is the working together, because before, from province to province, because before you had this was very local. It was all done locally, right?
Yeah.
And I say that could be a challenge because it needs to be coordinated.
Yeah.
So that might be a little bit more difficult than simply teaching grandma how to download the app and open it up on her phone when she needs to pay the bill. So yeah, you need to have a very well integrated, because it is national now, right? So you need to have this very well integrated from province to province to province.
Yeah, and on this level, I think when it comes to this new reform, when it comes to this family member sharing some of the money in their personal account, personal health insurance account, we are sort of seeing these changes happening very slowly. First of all, I think in pilot regions, for example, starting in 2021, China actually first started this kind of contributor versus and beneficiary sharing system. But at that time, it's only for direct family members, like for your spouse or for your parents and for your children.
Yeah.
And then it's only happening in a few very limited cities and provinces. And then starting from 2022 to 2024, I think, this kind of reform slowly expand to larger range of family members. We have now grandchildren, grandparents covered, and then covered more cities and provinces from 10 to more than 30 to currently, I think by the end of this year, that's nationwide. And we are seeing it going slowly precisely because there are a lot of coordination that we need to take care of, first of all. And then also at the same time, I think to getting people educated on some level as well. As we mentioned, the reform is trying to, I think on some level, tap into the generation changes, like the aging population that China is having. And we are seeing this imbalance between those who contribute to the medical public funds, the younger ones who don't need a lot of medicine
Yeah, they
or
don't
hospital
go.
visits.
They don't go to the hospital that often.
Well, on the other side of the panel is the grandparents who needs to go to the hospital on a regular basis, but possibly that, for example, they live in a villages in rural China. They don't have a lot of money in their personal account that they can use. So now we are seeing this reform is trying to unlock this kind of imbalance.
And it only makes sense. I mean, sure, grandma can go to the hospital in, her hometown, whatever rural community that could be, and then I could still send money to her WeChat account from Beijing. So it wasn't that grandma was left alone to pay for everything by herself. There's still family support there. It's just you're having to use your own money that is in your account as opposed to money that you've already put away into a different account that wasn't able to be used before because of the way the system was set up. So now with these changes, I mean, this is a big deal, I assume. This is a really, really big deal because it's just like unlocking the safe at the bank, right?
That is a question that I want to chase after you, Steve, that you mentioned. We talked about the housing fund before as well, and it's also trying to go to a very similar direction to encourage people can use their money more flexible. And I think when it comes to the healthcare money, the personal accounts, is also going to a very similar direction. You can use that money more flexibly. And so that is also sort of a change of a system that's also because a change of time. I mean, in the past, we have to lock away a certain amount of money for housing or for healthcare insurance because we just started to build up our employment and system on this principle of social solidarity, that we need some money to create this public funds so the whole society can use. But now things are changing and we can no longer having a huge amount of money locked away in a system and no one can actually use that. And that is so that we are sort of making the system more flexible, answering to questions like aging population, more flexible work labor in the system. And this is one of the changes I think the policy is trying to unlock. I think we talked about we have 1.4 trillion yuan sitting idle in the public pool that no one can use.
Yeah, I mean, I think the difference here is that with the housing, when we talked about the unlocking of the housing funds, you can use that money for things other than purchasing a home, but are still house related. For example, if you want to redo your bathroom, right? If you want to redecorate your kitchen, then you can use that money. This is a little bit different, right? This isn't, oh, well, I want to go get my nails done at the salon. Let me use my healthcare account.
Yeah.
No, it's not. So it's not apples to apples here. It's not exactly the same. The housing fund, you can use that money for housing related things, even if it's for aesthetic upgrades. Here, this is not for aesthetic upgrades. This is more on the side of being able to send that or use that money cross country with your family members.
Or I think it is from the perspective of a person who really kind of used this thing, because we can see it really in detail. The thing is that back then, of course, your account has that certain amount of money. It's not like you are like forbidden to use this money for other people. Still, you can like buy medicines for your kids, right? Just at the name under your name.
Yeah.
But the things that right now it is making these kind of things more official. It is under recorded. So and when I think the system or the policy is trying to make these kind of things clearer. And I think from another perspective that it is showing a kind of a clear trend that China's healthcare system is becoming increasingly open and interconnected. We mentioned that in the past it was highly localized, with only like different regions operating on their own different rules and policies. And recent reforms have focused on making like personal medical insurance benefits more portable across the country, across different family members. So in some cases, the funds in your medical insurance account can even be used by your family members living in other regions. This is, I think, the trend that showing the whole system, not only the healthcare system, but also the housing fund system. They're all going to the direction of being more open and connected.
Yeah, be more portable on some level, taking advantage of current technology. That we're talking about an app that can be as easy as that and easier to use for the most public in the society. But that is the direction of this policy. A lot of public services actually here in China is going to.